Most people think of hormones, they think of sex. What they don't know is how much hormones play a bigger role in their daily lives. Hypopituitarism is a rare disorder that affects 300 to 455 people per million. It can happen to anyone at any age and affects all types of different people. I am a mother of a child who has been diagnosed with hypopituitarism since she was 18 months old. I have gathered my research and information from different doctors, different websites, and friends who have children with the same disorder over the years. Hypopituitarism is a diagnosis that you get when your pituitary gland secretes a less than normal amount of hormones. One or more hormone has to be deficient in order to be considered having hypopituitarism. According to the Pituitary Foundation, these hormones include TSH, which is the thyroid stimulating hormone. It regulates your thyroid. Adrenocorticotropic hormone, which helps you handle stress when it releases cortisol. And growth hormone, which helps you grow. As you can see here by my drawing, this is the human brain. And here is the hypothalamus at the base of the brain. And just below it is the pituitary gland. It is about the size of a pea in our brains. How does someone get hypopituitarism? There's multiple ways that someone can get hypopituitarism. It can be genetic. It can be from a malformed pituitary gland, pituitary tumor, or a brain injury. To get the diagnosis of hypopituitarism, one has to first have problems. Usually this starts in a young child who has a lower than normal growth rate, and at that point they would start testing. Testing includes getting their growth hormone level checked, also getting a bone age x-ray of their hand to see how far behind their bones are in growing. Also, the thyroid would be checked to see if that's in a normal range, and also the adrenocorticotropic hormone. Most of those tests are done with blood draws. However, testing also includes an MRI scan of the brain, which you would then see if the pituitary gland is not of normal size. Sometimes it can just be shriveled up, or sometimes it'll be a normal size and just not functioning properly. If there is a tumor in the brain, then that would be the obvious reason why the pituitary gland was not producing enough hormones. At that point, if the MRI did show a pituitary tumor, then they would have to remove the tumor via brain surgery. If it is because the pituitary gland is malformed, then they would start with hormone replacement therapy. If someone has hypopituitarism, they must seek treatment because they're not going to be able to function properly. If someone were to get all of these hormones tested and they were deficient in all of them, this would be classified as panhypopituitarism. That would mean that there was absolutely no hormones that were functioning producing enough hormone from the pituitary gland, whereas hypopituitarism is one or more. According to the Pituitary Society, treatment of hypopituitarism requires hormone replacement, which usually is pills, or if it were growth hormone, that would be injections that would start when the child is first diagnosed and up until they reach puberty. As far as my daughter, when she was diagnosed, they wanted to start her on growth hormone immediately when she turned 2. And I decided that we would see where she was a couple years down the road rather than just committing myself and her to getting growth hormone injections every single day. And she has come a long way. She's still small for her size and age, but I think she's come a long way and looking good. And this concludes my speech on hypopituitarism. As you can see, hormones have a much bigger role in our daily lives than most people think. Thank you.